Thanks, Jerome. So as you know, we've thrown everything at this current outbreak. We locked down immediately. We had strict and we've had broad restrictions in place. They have done a terrific job, but the fight is still on. We still have significant community transmission occurring. We're seeing, in particular, transmission within households and potentially in social networks. So we are challenged by those mystery cases that are emerging every day. Those undetected chains of transmission are our primary challenge. For the cases that we know about, for the exposure sites, for the known chains of transmission, we are managing them really well. We are identifying those primary and secondary close contacts, they're quarantining and they're testing positive in quarantine. And so those 50% or potentially more of today's 80 cases in quarantine are the ones that are being managed fantastically. The challenge is with those who have not tested, who are suddenly turning up as positive cases and whose close contacts are already positive and have therefore been out in the community, sometimes very substantially. So the message again, the very first sign of symptoms, please get tested. That is the way you protect those nearest and dearest to you within your household and any other close contacts that you might have as an essential worker, as someone providing emergency or compassionate care to others. If you don't know your status, you are putting others at risk. So for those that you love, for those that you care about, for those that you want to keep out of hospital, out of ICU, off a ventilator, please get tested. If you don't know your status, you could be putting others at risk. We're still learning things about the Delta variant. We know it's highly transmissible. We know it moves very fast. We know it causes really significant illness. What's become apparent in recent weeks is that maybe 3/4 of transmission with the Delta variant occurs without symptoms or before you've developed symptoms. And so it is really critically important as well to minimise those contacts, to not go out if you don't have to. And to absolutely wear a mask and maintain social distancing in all the circumstances that you can, because it is a highly infectious virus. And so testing is critically important, but you have to assume that you could be infectious, even without symptoms, at any time. And the idea that you're not in the right suburb, there's been no cases here, there's been no significant transmission identified around where I live or where I work, might be true today, but it may not be. You don't know until it's been identified. And this virus has moved silently and with stealth across Melbourne and into regional Victoria. And so please don't say, I'm not at risk because I'm not in this demographic or in this part of Melbourne or in this workplace or in this particular sector. You are at risk if you're in Victoria, if you're in Australia. We simply can't assume that we're not at risk because we'll be surprised. All of a sudden that test will turn around, you'll be flabbergasted by it, but it is a risk to everyone as long as we're still fighting through this pandemic. In particular, we've seen transmission between children and from children to adults within households. And so bear in mind that of the 600 active cases we've got now, 128 are below 9 years of age or up to 9 years of age. 106 are between 10 and 19 and another 107 are between 20 and 29. So there is a risk of transmission from children to other children and children to adults. And with such a substantial number of our cases being in those age groups, sometimes with very mild illness, please take your children to be tested if they've got any symptoms whatsoever. And again, please make an assumption that this is COVID-19 until proven otherwise. We are establishing those epidemiological links with mystery cases, but as I say, if a case tests positive and they've never been identified as a primary close contact, then they've exposed other individuals. So doing the right thing all of the time, protecting those within your household and those that you love and care for, by doing the right thing and not having any unnecessary contact with them is a really critical piece. it is super encouraging to see the vaccination numbers. I know there's been a lot of talk about 70 and 80% thresholds. I think we could get to 90% easily in Australia. We've got a long and proud history of high vaccination coverage. We understand the benefits of vaccination to protect us from all of the vaccine preventable diseases. And our childhood immunisation rates for measles, mumps, rubella, whooping cough, polio, tell that story. We know exactly what it does, and that's why we've seen these illnesses disappear from our community. We know exactly what it means for COVID-19 as well, and it's so good to see such a significant number coming forward. I hope those numbers continue, and I hope that we aspire to even higher numbers than those targets that have been set nationally. Thank you.
Happy to take any questions.
Professor, not to sound like a broken record here, but realistically, how likely is it that we're going to be in a position to come out of this in a week, and what day will you make an announcement?
You are very much sounding like a broken record, I'm afraid. The Premier's made a statement on that. I haven't got additional advice today on that matter. We will, as we do every day, review how it's going. Clearly, today's a challenging day, and numbers are not going in the direction that we would like them to, but we still know the principles at work. And they are fundamentally what the restrictions are. And if people can follow those restrictions to the fullest extent, we know that that can turn the numbers around. In particular, in relation to minimising your contact with any other people to the fullest extent that you possibly can. We know there are essential workers. We know there are essential services that people need to access. People need to go out for food. If you can minimise those interactions to the fullest extent possible and have no other interactions that are not allowed, that'll turn it around. We know that.
But in 1 week?
Sorry?
But in 1 week?
I don't
everything
know.
Went
I don't
well?
know. We have to follow it each and every day.
Brett, I mean, are there particular areas of concern for you? I mean, we've got 80 obviously, but are there particular areas of concern in Melbourne and in Shepparton that are holding us back?
Well, certainly we know that the Inner West and Altona LGAs have been challenging. They continue to pop up with new cases. But any case without known acquisition is a challenge for us. And what starts with one case is quickly 20 cases. So I don't want to, again, provide false reassurance that anyone across Melbourne or indeed Victoria shouldn't think that they don't need to follow the very advice that we're giving here today. Sure, there are areas where we're seeing more activity, inner west, inner southwest, Hobson's Bay, but northern suburbs have popped up with some new mystery cases. So we really need to keep our eye on the ball across Melbourne and beyond.
In your initial comment, you noted some of the difficulties we're facing. The strain's really infectious. Compliance isn't at its absolute peak. People not getting tested for up to a week at a time. And really all it takes is one person possibly to not get tested for a week and it can cause more cases. Does that not show that getting to zero in the circumstances we are is an impossible task?
Look, as the Premier said, we have an aggressive suppression strategy. If we can get to zero, fantastic. But if that is not attainable, we're still not going to let it run. We're still not going to allow thousands upon thousands of cases to emerge because we know that the restrictions hold that in check. So it's not a binary choice of zero cases or allowing thousands upon thousands of daily cases to emerge. We have to do absolutely everything that we can to protect every citizen's health and well-being and our health services and our hospital system, our ICU capacity, and our crematoria and funeral services, which to this day continue to be challenged around the world. Florida has crematoria with bodies piled up in refrigerators. This is in the United States of America because they have overwhelming numbers of cases daily and hundreds of deaths.
Tony Blakely put forward this idea at the start of the week of a lockdown light, kind of moving one level below, so I don't know, people gathering outside in small numbers. What do you think about, at some point, lessening some of the most onerous restrictions on people?
Of course, we would consider all options if we can understand the modelling, know what it means, and be confident that that'll keep a cap on transmission. So if there are circumstances where we can ease, we will absolutely look at them. Understanding, again, the mental health benefits and the relief from what is particularly challenging time across Australia, but in the eastern seaboard in particular.
At what point do you start to consider that? If we're forecast to say get to 70% at the start of November, are we just going to have, for example, a curfew on up until the day we get to 70%?
I don't know. We will look at it each and every day, but there is no magic number. Even the Doherty Institute has said that. There's no great revelation that you get to at 70% where everything changes. What we need to understand is that there'll be a level of public health restrictions that need to be in place to manage that risk of transmission right through. It becomes less and less of an imposition the higher that vaccination coverage gets. And we shouldn't stop at 70%, we shouldn't stop at 80%. We can get higher, and that means even greater freedom. So we should continue to aim high.
How likely is it we're going to have the same settings, except with no curfew and playgrounds reopened for the next 8 weeks? Is that something you're
I don't
considering?
know. I honestly don't know. We
considering?
are looking at how things emerge each and every day. We can have good days and it looks like it's trending in one direction. We can have a day like today where it's clearly either stalling or getting worse. We need to recognise what those day-by-day challenges will be and make adjustments accordingly. Putting every restriction on is throwing the book at this virus. But if there are some things that can ease, that don't place lives at risk, we'll absolutely look at them.
And again, it's asked all the time, but how much are you weighing up the mental health burden on a lot of particularly school-aged kids and families of homeschooling? How much is that weighing on you when you're looking at the next step for next week?
It weighs all the time. Again, as the Premier said, if there's another plan that doesn't have a burden that's even greater, either because children lose a parent or a grandparent or become sick and hospitalise themselves, or because a lockdown is on for a longer period of time, those are the awful choices that we're faced with. Shepparton's going through a very hard time right now. They've got thousands upon thousands of people in quarantine. But if Shepparton can get to a point where they've got no active transmission and they can go back to leading relatively normal lives, well, how much better will that be for adults, for kids, for the entire region? So much better is the obvious answer. But you have to make those sacrifices to get there, and there is no easy choice where you say, oh, we'll ease it because we know what a significant burden it is to be in quarantine, to be restricted so greatly when the alternative is much, much worse.
What work's being done on the over 60s? There's no supply issue of vaccines for people over 60. They're at 80% roughly. What about that 90, 95, 99%?
We'll continue to push that.
There?
We know that we can get high vaccination coverage for over 60s. We know that there are cohorts that have gotten to over 97%. ACT over 70s, I think, have gotten to 97% coverage. So again, we shouldn't sit on our hands because there's vaccination coverage at a particular level when we know that we can keep going, and we know that we've still got first appointments of AstraZeneca in their thousands every day. So there are still people stepping up for that, and that includes a lot of over 60s.
Would that give you more options if we've got to 97, not let's say 100% of over 60s who are the highest risk of
of course it does, because we know that those...
Does that mean you can ease restrictions quicker?
Yes, it does. We know that the higher the coverage for those most at-risk individuals, over 60, over 70, prevents hospitalisation and ICU admission. We know from the global picture and from ICU admissions in Victoria and New South Wales in particular, a fully vaccinated person is a rare individual in ICU. And so for over 60s to get to close to 100% vaccination coverage, that keeps them out of ICU and stops them dying. So, of course, that provides greater assurance that we can ease restrictions without putting that very significant cohort of the population at greater risk.
So if grandparents want to get their kids, their grandkids back to school, is the message to them, get a vaccine to get your grandkids back to school?
For everything. For the protection that they'll have in terms of going out in the community themselves, their interactions with their broader family, including kids. Of course it is.
Brett, early last week you said you're investigating a possible case of transmission at a playground. Has that concluded?
I don't have any more information on that. I think some of these circumstances we don't get a definitive answer. We know where people have been. We know they picked it up somewhere. We don't have an alternative explanation, and that becomes a working hypothesis. But we can't see the virus transmit from one person to another, so we don't know definitively. We do know that children transmit pretty readily between each other. There's talk about the studies of playgrounds having a pretty high viral load on swabbing of playground equipment. It's probably not through surface contamination that it occurs, though. It's probably through airborne transmission for kids. So I'm not concerned that it's a hygiene issue of playgrounds needing to be wiped down. I'm concerned that it's transmission between kids getting close, and we know that they don't physically distance in a playground. Sure, we'll encourage them. Some kids might wear masks in those circumstances, but a lot will just be in very close contact with complete strangers in other households. So that's a concern. But yeah, we don't have a definitive answer on that particular circumstance.
Just on Shepparton, we've got those thousands of people in isolation and work's underway for these day 13 tests. If people turn positive on day 13, that will presumably generate some further contacts or exposure sites. So why not test people in the middle as well on, say, day 7 or day 8?
So it doesn't generate more contacts. They are in quarantine with their close contacts. So all of those individuals are quarantining. And so if somebody tests positive on day 13, all of those individuals who've been quarantining with them continue their quarantine until they finish a quarantine period. But it doesn't generate more exposures because they've all been in quarantine together.
Is it not possible that if someone had turned positive on day 2 or 3, that they would have had contacts or exposure sites before they were put into isolation?
No, we look at the exposure sites that have generated them as a contact. That's why they're in quarantine. If they're a case and they haven't been in quarantine before testing positive, we do get that early positive test back. So for whether it's the MCG or Amy Stadium or Miss Frankie's restaurant, we get those early results across the board for people. If they've turned positive and we know that they've had a period of time out in the community, we generate those exposure sites and there are more contacts. But if they haven't tested positive early on, then that's not an issue.
And on vaccines, Martin Foley mentioned last week there were discussions about targeting particularly these Polish Pfizer doses to either geographical areas or essential workers or particular groups. Why have we decided not to do that, or what is the merit in targeting those groups?
I think we're still looking at prioritisation within the quantum of vaccines that are available. We do know that there are people who are more at risk in terms of severity of illness, and so they've always been targeted. That's been our age cohort and disability and healthcare prioritisation. But there are also some industries that are more critical. There are some industries where the risk of transmission to vulnerable people are of greater concern. That's why the aged care workforce and the healthcare workforce have been prioritised. So that'll remain on the radar for us. But it's pretty clear that what we mostly want to do now is just crack on with as many doses as we possibly can, get that high population coverage, because it's moving towards that suppression of transmission across the board, especially for mobile working age populations. It's going to make a difference now.
Can I ask one for Brett while you're still there? Sorry, Brett. Just another topic. How concerned are you about allegations that evidence against iCook Foods was doctored?
Oh, look, I've said before, as a matter before the courts and as a matter that I'm going to speak at the parliamentary inquiry at next week, I'm not going to comment here. Very happy to speak at any other fora where I'm required to do so.